Hey everyone, welcome back to the channel. Today we're talking about gynecomastia, a condition that might seem alarming but is actually more common than you'd think. Gynecomastia is the enlargement of male breast tissue, and in most cases, it's caused by a hormone imbalance between estrogen and androgens. Let's dive into it. So when does gynecomastia happen? It can show up at various life stages: infancy, during puberty, or even later in life. Hormonal changes are usually the culprit, but it's important to remember that medications, liver disease, or even tumors can also play a role. Now let's talk treatment. Some cases resolve on their own, but others may require medication or even surgery. If a patient walks into your clinic with enlarged breasts, here's how to approach it step by step. First off, take a good look at their history. You want to ask about any liver disease and the medications they're taking. Some common offenders are anti-psychotics, anti-emetics like metoclopramide and methyldopa. Then there are anabolic steroids, often used by athletes, and other medications like digoxin, phenytoin, spironolactone, and finasteride that can all contribute to gynecomastia. Next, if there's no clear history pointing to liver disease or medications, it's time to get a breast ultrasound. This will help us figure out if we're dealing with pseudogynecomastia, which is just fat accumulation, or true gynecomastia, where there's actual glandular tissue involved. For pseudogynecomastia, the solution is often weight loss and lifestyle changes. But for true gynecomastia, we need to dig deeper with a hormonal workup. The main hormones you want to check are free testosterone, estradiol, and prolactin. If testosterone is low, it's time to evaluate further by checking luteinizing hormone LH and maybe even ordering a testicular ultrasound. If LH is high, that suggests a testicular issue like primary testicular failure. But if LH is low, the problem could lie in the pituitary. Now, if estradiol is high, this raises the possibility of a testicular tumor. In these cases, a testicular ultrasound and checking HCG levels are essential to rule out malignancies. For elevated prolactin levels, especially if they're above 100 nanogram milliliter, you'll want to get a pituitary MRI to rule out a prolactinoma. But what if everything comes back normal? No hormone imbalances, no liver disease, and no medications causing it? That's when we call it idiopathic gynecomastia. For these patients, tamoxifen, typically 10 to 20 milligrams daily for 3 to 6 months, can be an effective treatment option. Make sure to follow up regularly to monitor progress. So, while gynecomastia can seem complicated, a structured approach to diagnosis and treatment makes it much more manageable. If you found this video helpful, make sure to give it a thumbs up and hit that subscribe button for more medical insights. Thanks for watching, and I'll see you in the next video.